Hi, my name is Erica and I'm a physical therapist at Maine Medical Center. My hope for this video is to provide you with some helpful information as you prepare for your upcoming total joint replacement. As a physical therapist, I'm going to be part of the team that will work with you during your admission to instruct you on your therapeutic exercises, functional mobility, ambulation, and other safety information prior to your return home. During your hospital stay, you'll work with a physical and an occupational therapist multiple times a day to prepare you for returning home. A physical therapist will work with you on functional mobility, how to get in and out of bed, how to ambulate with the right type of equipment, how to negotiate stairs, and instruct you on your therapeutic exercises prior to returning home. An occupational therapist will instruct you on activities of daily living, how to modify those activities, and instruct you on how to use different types of equipment to make those tasks easier. Please bring a few pairs of loose-fitting, comfortable gym-style clothes with you to wear during your therapy sessions while in the hospital. Each evening, your tentative therapy schedule will be posted on a whiteboard located in your room. The reason that we post these times in the evening is to allow you to prepare for your meal times, your pre-medication, and to have any family members or friends available to you during your therapy sessions. We encourage your family members or caregivers to be available for at least one of your therapy sessions prior to discharge. This allows an extra set of ears and eyes to be available to reinforce any information that's taught to you during your hospitalization. One of the benefits of having an elective surgery is that you have ample time prior to your hospitalization to prepare yourself, your family, and your caregivers, and your home for your discharge after your surgery. Plan A should be for everybody to return home 1 to 3 days after your surgical procedure. Things that you can do to prepare your home for your return are to remove throw rugs and electrical cords, or tape them down with a heavy tape such as duct tape, as these are tripping hazards, as well as if you have any stairs in your home, to make sure that there are sturdy rails on at least one side of the steps. A few other things you can do to prepare for your return after your total joint replacement are to have multiple meals prepared ahead of time and placed in the freezer, to have all of your laundry done so you don't need to be carrying laundry baskets around your house upon your return, to have a cell phone or a portable phone with you most of the time in case of an emergency. And if you live alone, please plan on having a family member or a friend or a caregiver of some sort stay with you for 1 to 2 weeks after your discharge from the hospital. A caregiver will help with transportation and heavy household duties upon your return. We will ask you to have a couple of different pieces of equipment to help walking be easier after your surgery. Please bring a rolling walker with you on the day of your admission. This is an example of a rolling walker. It has 2 wheels in the front, has 2 pegs in the back. This type of walker is adjustable to an extent. However, if you are 6'4" and your mother is 5'2", you will not be able to borrow her walker. When you stand within the frame of the walker and let your arms drop down to the sides, you do want the handle to be hitting you at about where your thumb meets your wrist. This lets you do a quick and easy size if this type of equipment is going to be the appropriate height for you. When you start walking with your bedside nurse or your physical or occupational therapist, they will have you stand within the frame of the walker and just push it like a shopping cart. So you're going to push it ahead of you. You're going to stay right within the frame of the walker and go right along with you. If you've used crutches in the past and are very comfortable with the crutches, your physical therapist can work with you. However, this will always remain the gold standard for type of equipment to walk with after any kind of total joint replacement. Other types of walkers that are available on the market that are not recommended after your total joint replacement are, this is a standard walker. It looks similar to a rolling walker, however it doesn't have the wheels in the front. So it has 4 pegs instead of 2 wheels and 2 pegs. The reason that we don't recommend this type of walker is that it doesn't slide, so you're going to have to pick it up and be a very discontinuous gait pattern. The good thing about this type of walker, however, is that you can obtain the wheels and swap out the pegs for the wheels. That can be done at a durable medical equipment store prior to your surgery, or your physical therapist can help you with that during your hospital admission. We also get a lot of questions about this style of walker. This is called a rollator. And although they're often called the Cadillac of walkers, they are not recommended after a lower extremity total joint replacement. The reason for that is that they get away from you too quickly. You don't have enough control when you have lost strength or range of motion in one of your legs. The other reason that we don't like this type of walker is that the built-in seat does not promote upright posture. So in order to accommodate the seat, you have to keep the walker out in front of you, and then you're walking bent over. Okay, so if this is the only type of walker that you have access to, please talk to your doctor or the surgical team about getting you a prescription to having a rolling walker. That can be done before your hospitalization or while you're here. Other types of equipment that may be useful to you after surgery, but not necessary. This is what's called adaptive equipment. This is a reacher. This is a sock aid. Again, they're not necessary after your surgery, but they might make some of your ADLs or your activities of daily living a little bit easier for you and allow for more independence. If that's the case, an occupational therapist would be happy to show you how to use this type of equipment prior to your discharge. Raised toilet seats or commodes are similar to the adaptive equipment. They aren't required, however, they might make your life a little bit easier if you have, especially if you're taller and if you have access to them prior to your discharge. Last piece of equipment, we will ask you to have a cane upon your return to home, but you do not need to bring it with you in the hospital. If you only have one railing on your stairs at home, we'll show you how to get up and down the stairs or climb and descend the stairs using one railing and one cane, but we are happy to lend you our cane during your hospitalization. I'm just going to do a quick demonstration of how it looks like climbing the stairs. So say if I had a left knee replacement, I'm actually going to go up with my right leg. So I'm up with the good leg. Operative leg comes to it. Okay, you're going to go one stair at a time. If your bedroom's located on the second floor of your home, we'll teach you how to go up and down the stairs appropriately before you return home. On the way down, you're going to do the opposite sequence. You'll hang onto the rail, cane in the opposite hand. Cane will come down first. Your operative leg, or in my case, the left leg, will come down first. Again, one stair at a time. Cane, operative leg, good leg. I hope all of that information was helpful and put your mind a little bit more at ease coming into your total joint replacement. And I look forward to meeting with you and working with you during your hospital stay.